as clinicians who treat pigmentary disorders, melasma is one of the most common conditions that we see, and we all recognize its challenging nature therapeutically, in that treatment outcomes are often inconsistent, relapses are common. Now, it turns out that recent advances in our understanding of the pathophysiology of the disease may reflect the challenging nature of it therapeutically. So what I mean to say is that the underlying etiology of the disease appears to be more complex than originally thought. Historically, we were focused on three main factors: UV radiation, genetic predisposition, and hormonal factors. But data over the past 10 years, research studies over the past 10 years, seems strongly suggest a more complex pathophysiology with interactions from the keratinocyte, fibroblast, visible light, features of photo damage being important in the pathogenesis of the disease, vascular factors. And so this has direct implications on the way we should optimally approach the treatment of this disease, in that if we focus solely on our traditional targets of UV radiation and reducing pigment formation using bleaching agents, we're missing many important aspects of the overall disease. So specifically, in my presentation, I discussed the use of lasers to address the vascular component, or agents such as tranexamic acid to address the vascular component of the disease, and how that may result in better outcomes and more durable outcomes when treating melasma. The importance of visible light cannot be underemphasized. We're learning more and more that not just UVA and UVB, but visible light is an important factor in melasma. It's been shown that visible light can actually stimulate melanogenesis, especially in darker skin phototypes. And blue light in particular, blue visible light, is sensed by the melanocytes and it results in increased pigment production. And so when it comes to sun protection recommendations, we need to incorporate agents that block visible light as well, such as iron oxide. So sunscreens that are broad spectrum and also include mineral, such as iron oxide, to block the visible light spectrum gives you a more total and complete protection against the important light-based pathogenic factors of the disease. So in summary, approaching the therapy of melasma more holistically, considering the vascular component, the visible light component, and other aspects of the disease, such as photo damage, will ultimately result in better treatment outcomes. Consistent with the complex pathophysiology of melasma, the approach to treatment of melasma is also multimodal and complex. It involves protection against UV radiation, as well as protection against visible light. It involves reversing some of the effects of photo damage. It involves decreasing pigment production and removing excess pigment that's already been produced and deposited and taken up by keratinocytes. So in order to approach the treatment of melasma and have effective outcomes, we depend on topical therapies with different mechanisms of action, energy-based devices, chemical peels, oral agents, and sun protective behaviors and sun protection topically applied to get successful outcomes in the treatment of melasma.